Hi, my name is Tianran Zhang. I am a PhD student at Atlantic Technological University in Sligo, Ireland, within the Health and Biomedical Strategic Research Center. I recently published comparing real and virtual nature exposure on cognition, well-being, and brain activity in adults with and without ADHD, the protocol for a randomized experimental study in JMIR research protocols. In this protocol, we set out to answer a question that's simple to ask but surprisingly hard to answer. Most of us know that spending time in nature can help us feel calmer and think more clearly. But what's far less clear is why this happens in the brain and whether immersive virtual reality can deliver the same benefit or only the appearance of it. This matters because access to real nature isn't equal, and VR is increasingly offered as a scalable alternative, yet we still lack solid evidence on how it works and who it works best for. In our study, adults with and without ADHD complete either a short real nature session or an immersive VR nature session. We then measure changes in attention, mood, and brain activity and track how long any benefit lasts. The crucial point is that we don't just ask whether people feel better. Using mobile EEG, we look at whether the brain shows patterns linked to genuine mental restoration or to more effortful cognitive engagement. This distinction is what tells us whether VR nature is truly restorative and for whom. We've published this protocol openly before data collection begins, and that's also part of why we chose this journal. We chose JMIR Publications because it is a leading open access venue for digital health research with a strong readership at the intersection of technology, cognition, and clinical application. Publishing this protocol here lets us share our design transparently and reach the interdisciplinary community most relevant to this work. Ultimately, that's the purpose of working at a mechanistic level. Understanding how and for whom these effects occur is what lets us move towards a more precise and more responsible use of technology in mental health, the right tool in the right way for the right people.